If you have one or more missing teeth, you are not alone. Loss of one or more teeth, or edentulism, affects a large portion of the world's population. In North America, we're behind many developed countries in our level of awareness in this debilitating disease. The loss of a single tooth often creates a domino effect and leads into loss of additional teeth. Where a tooth is lost, the surrounding bone gets rapidly depleted and gets lost as well. Tooth loss also affects a patient's natural appearance and profile, and people who have lots of missing teeth generally look more aged and tired and have more wrinkles around their faces. The proper functioning of TMJ, or temporomandibular joint, gets compromised, and that affects the jaw nerve and jaw muscles that are associated with the joint. Patients often experience headaches due to such compromise. There are also additional tangible and intangible side effects. Chronic low-grade headaches, having to stop in the middle of eating a normal food, such as a sandwich. Muscle pain, sensitivity on teeth that are often, they may seem unrelated to a tooth that is lost, but in reality it is. Loss of confidence in social occasions, social interactions due to the display of an undesirable missing space due to a missing tooth in the smile. To me, these are all examples of how edentulism affects the quality of one's life. Historically, edentulism has been a problem that dentistry has had no cure for. Traditional dentistry has only been able to mask the problem by offering patients inferior alternatives such as dental bridges or traditional full or partial dentures. Patients have always lived with such compromises because it has wrongly been socially accepted. Unfortunately, our parents have suffered from edentulism, and to many, that has made the problem less horrifying. As our society's level of awareness regarding dental health increases, we're becoming more and more aware of new solutions to edentulism. I feel for the first time we have an answer to this old problem, and that is dental implants. To replace teeth with dental implants, typically there are three components. The dental implant itself, which is a titanium post that mimics the shape of a natural tooth's root. The abutment, which is what emerges from the dental implant above the gum line. And the tooth replacement itself, which is giving the patient the ability to chew, smile, and function properly. The successful replacement of a dental implant by dentists depends on the dentist's ability to closely mimic the natural biology and physiology of a tooth and the surrounding gum tissue and the bone. For this reason, I firmly believe that the criteria for a patient to choose a qualified dentist who can render such treatment should be A, the level of awareness of the dentist, and the level of their experience. In the past, in most dental practices, the restorative dentist who diagnoses the need for a dental implant refers the patient to an oral surgeon or a periodontist who can perform the implant surgery. And after the placement of the dental implant, the patient gets referred back to the restorative dentist for the next phase of the implant procedure. The weak link in this method is the communication flaw between the restorative and surgical dentist. I find it to be a much more efficient model for the person who's having the tooth placed by the restorative dentist to also have the implant placed by the same dentist as well. Patients find that a much more efficient system for having the tooth replaced. I believe both models could work very well and could be successful. However, the dentist who performs the dental implant procedure needs to demonstrate a profound understanding of the implant, bone, and the tissue biology. He or she also needs to express a clear vision of how to restore a dental implant successfully after the implant is surgically placed. With minor exceptions, I feel all patients who are suffering from edentulism are candidates to have their smile restored and their health restored as well. My staff and I have gone through extensive training, and we have performed a large number of surgical procedures in order to provide such great service to our patients who are suffering from edentulism. Yeah, all services will be performed in our facility, including any surgical placement. All bone grafting will be done in our office. We don't have to refer you to any other dentist, and we can start and finish the procedure for you here in our office.